Welcome to UMCC, Medical Consultant Connectors, where your health matters to us. Ever wondered what acute glomerulonephritis is and how it affects your health? Well, let's unravel this medical term together. Acute glomerulonephritis is a serious kidney disorder that involves inflammation of tiny filters in your kidneys, called glomeruli. This condition can hamper your kidney's ability to filter waste and excess fluids from your blood, which can have a significant impact on your overall health. Think of it as a roadblock in your body's waste management system. Now that we've established what acute glomerulonephritis is, let's explore its causes. Acute glomerulonephritis isn't a disease that occurs out of the blue. It's often the result of the body's immune response going overboard after an infection. Think of it like a well-intended friend who, in trying to help, ends up causing more harm. Infections that can lead to this condition may include strep throat or skin infections, especially in children. In adults, it's more often seen after viral infections like HIV, hepatitis B, or hepatitis C. Immune diseases like lupus, Goodpasture's syndrome, and IgA nephropathy can also trigger acute glomerulonephritis. Vasculitis, an inflammation of the blood vessels, is another potential cause. Despite these different triggers, it's important to remember that this isn't a contagious disease. It doesn't discriminate either. It can affect anyone at any age. Understanding the causes is the first step, but recognizing the symptoms is equally crucial. So, how would you know if you're suffering from acute glomerulonephritis? Well, several symptoms could raise a red flag. Let's explore them. One of the first signs is a change in your urine. It may appear brown or pink due to the presence of blood, a condition known as hematuria. You might also notice an increase in protein in your urine, resulting in a frothy appearance. Another symptom to watch out for is swelling, often noticeable in your face, hands, feet, and abdomen. This swelling or edema is due to excess fluid buildup in your tissues. High blood pressure is another telltale sign. This is because the disease can cause your kidneys to produce excess renin, a hormone that can elevate blood pressure. Remember, these symptoms may not appear immediately. They can develop over several days or even weeks. So it's crucial to pay attention to your body and any changes you notice. If you notice these symptoms, it's time to seek medical help for diagnosis. Diagnosis of acute glomerulonephritis includes a series of tests. To get to the bottom of what's going on, medical professionals typically start with urine tests. These tests look for red and white blood cells, high levels of protein, and other substances that indicate kidney damage. Next up, blood tests come into play. By measuring the levels of waste products, such as creatinine and urea, these tests can provide insight into how well your kidneys are filtering your blood. But sometimes these tests aren't enough. In such instances, a kidney biopsy might be necessary. This procedure involves using a special needle to extract small samples from your kidney, which are then examined under a microscope for signs of damage. Once a diagnosis of acute glomerulonephritis is confirmed, it's time to talk about treatment. This often involves medications to control high blood pressure, reduce swelling, and protect your kidneys from further damage. Changes to your diet can also play a crucial role in managing this condition. Reducing salt, fluid, and protein intake can help keep your kidneys from working overtime. In more severe cases where the kidneys are failing, dialysis or a kidney transplant may be necessary. Dialysis involves using a machine to filter waste products from your blood, while a kidney transplant involves replacing the damaged kidney with a healthy one from a donor. While treatment can manage the disease, prevention is always better. Therefore, keep an eye out for the early signs and take good care of your health. Preventing acute glomerulonephritis involves some simple yet essential steps. Maintaining good hygiene is the first and foremost step. It's vital to wash your hands regularly, especially before meals and after using the restroom. This simple habit can keep many infections at bay, including those that can lead to acute glomerulonephritis. Next, don't underestimate the power of regular medical checkups. These allow for early detection of any underlying conditions which might put you at risk. Timely intervention can prevent complications, including kidney diseases. And remember, managing chronic diseases is equally important. If you have conditions like diabetes or hypertension, keeping them under control is crucial. Regular exercise, a balanced diet, and proper medication can go a long way in maintaining your kidney health. So don't wait for the storm to pass, but learn to dance in the rain. Prevention is always better than cure. Remember, your health is in your hands. Stay informed and stay healthy. Before we wrap up, let's revisit the key points. Acute glomerulonephritis is an inflammation of the kidney's tiny filters. Its causes range from infection to autoimmune diseases. The symptoms, like tiredness and pink or foamy urine, are subtle yet significant. Diagnosis often involves blood tests and kidney biopsies, while treatment can include medication or dialysis. Preventive measures involve regular checkups and a healthy lifestyle. Remember, early detection is key to a successful recovery. Thank you for joining us today. Stay tuned for more health-related topics. UMCC, your ultimate medical consultant connector.